Well, it's 2026, it's March, and we wanted to give you an update on what we're doing at Ellsworth. We got a lot of irons in the fire, and we're growing our capabilities, and we just wanted to share that with our folks here. We're happy to be continuing placing our talented candidates in New Mexico and Arizona. And we have a great database of indigenous talent, have a lot of great medical professionals who have worked in Indian Health Service, who love working with our relatives. So I don't want to gatekeep any of our talent. We've been looking at solicitations in South Dakota, Utah, a lot of new places in New Mexico, and even in Virginia. So we're growing, and we're sharing our capabilities with any of our contract officers who want to place great candidates in their facilities. The types of roles that we're filling are nurses, our physicians, and even now with our admin, we're expanding our talent pool to place IT. We're responding to administration positions, and we're ready to continue to grow our database so that we can place qualified candidates in the places where they're most needed. Ellsworth has really found its sea legs. I certainly have with what it takes to place a candidate, recruiting and finding good quality candidates and resumes, and really the people and the passion and the talent behind those resumes. I've been able to scale a lot of our database building, and we're using agentic AI, and we're placing candidates a lot faster, and we're willing to place our candidates a lot faster when our contract specialists, our folks on the ground, want to have them. We're really looking forward to expanding our capabilities into being a managed service provider. And that really means that, not only are we helping place candidates in one particular area, but we're able to expand our reach to other facilities, and cutting through that a lot faster. That's talking about the speed and the agility of where we can place our candidates. And we're looking forward to creating kind of a novel way of helping staff Indian Health Service. And we're looking at great ways to innovate and really be good partners with the Indian Health Service. We're talking about what that is it's a big swing, it's a big bite, and we want to let the Indian Health Service know that we're ready to serve our relatives the best way that we possibly can. As I've probably been talking about since last year, I really found that the way to on-ramp our community is to really get them engaged in any possible way that we can. And I think one of the best ways is removing barriers to access to education. And I think the best way that I can provide that, and what I've seen out there, is providing vocational certifications. And what we've been working on is to launch an online vocational college that will offer EKG tech, phlebotomist, certified medical assistant. So we're looking at other programs, probably about 15 to 20 online vocational programs that can bring our citizens, our young people, into the healthcare industry through innovative ways, through the ways that a lot of people are pursuing careers, and it's vocational certification. So we're really looking forward to that, and we've been in the application process. Again, one of the irons in the fire that we're working on right now. With the managed service providers becoming one of those companies, we're able to moonshot a lot of the aspirational goals of hiring staff and filling and kind of fixing the staffing shortage that is happening in Indian Health Service. So we're looking forward to that. We're very close to finishing our application, and we'll give you an update when we know it as well. Also, another one of those irons in the fire We've been pursuing a GSA certification to be listed on eOffer. We know that a lot of bottlenecking in the solicitation process can be remedied when we're listed on GSA. So we're looking forward to getting that process finished and helping move our candidates into the Indian Health Service a little bit faster than we have before. For Ellsworth, we want to be, at your service for the Indian Health Service. And that really means looking into ways that we can best serve our contract officers, our corps, be more responsive, and really, as we mature in our company, we're able to be better partners. And I think that's really part of our long-term vision, is to make sure that if there's something that our people need, and it's this entire ecosystem of healthcare for our people. I mean, the people that are behind the scenes making this all work, they really are passionate about helping out the needs of their community, and we always want to be there to help them out. So we're looking at innovative ways that we can do that. So a lot of the technologies that are happening outside of what we think is Indian country all have implications to our people, and I want to bring a lot of those topical, newsworthy information and apply that to how that works out for Indian country. There are staffing shortages in Indian country, but it's not just limited to the Indian Health Service. There's a lot of tribally managed facilities that also need attention to staffing. Regional areas, rural areas that also need attention as well, and even our urban health centers need indigenous input. And so we want to learn every part of the healthcare system in the United States, and help you and help us all understand how that affects Indian country and how that affects our people. And so we're blogging a lot more about that. We're talking a lot more about that. What does the one big beautiful bill mean for Indian country? What is the new changes to Medicare, Medicaid? How does that affect Indian country? And we want to keep having that conversation. And we know that Native voices and Native professionals need to be at that seat at the table. And we're going to keep fighting for all of us to get the healthcare that we deserve, and have an innovative healthcare system that the high quality for our people, that is highly focused on culturally competent care. What does that look like, and how does that feel in action in our healthcare facilities when we're putting our indigenous ways of knowing with the latest healthcare innovations, and so that how we can best serve our people. So we're thinking about a lot of things, we're doing a lot of things, and we want to thank you so much for being a good friend of ours at Ellsworth.